World Stroke Day, which falls on October 29th, is recognized to spread awareness of stroke among people. Every year, about 17 million people get affected with stroke, of which 6 million die and about 5 million get affected with disability.
Stroke is a leading cause of death and disability in our society. Stroke can happen when there is an abnormality of the blood supply to brain, either due to lack of blood supply or due to sudden bleeding due to rupture of a blood vessel.
Stroke is caused due to several risk factors, and these risk factors include diabetes, high blood pressure, high cholesterol, high serum homocysteine, and it is also more common in people who smoke and consume alcohol and those who have a positive family history of stroke in them. The commonest symptom can be weakness or numbness of one half of the body, including the face, difficulty in speaking or understanding the spoken words, decreased vision on one half of the visual field, that is one side they cannot see, sudden severe headache, imbalance or incoordination while walking. They are the main symptoms.
So as we all know, there are 8 Ds in the stroke chain of survival: the early detection, rapid dispatch, delivery, door, data, decision, drug, and then appropriate disposition. Out of these 8 Ds, 6 of them have to be appropriately handled in the emergency department. And for any good accredited stroke center, particularly Joint Commission accredited stroke centers, it is important that the emergency department becomes an integral part of the stroke team. And that's what you have at Apollo. Right from the pre-hospital care, which is delivered by the EMS, to the immediate arrival in the emergency department, I think the emergency team makes a very important contribution in identifying the stroke and managing the acute stroke, and then giving it to the other specialists to continue the further management for these patients.
Treatment of stroke is time dependent. The best treatment options in stroke are there before 3 hours. If the patient reaches the hospital in 3 hours, and if we can initiate treatment within 3 hours, we can give an injection called TPA, which can give 30 to 50% response rates in stroke patients. They can become almost near normal in 50% of these patients. After 3 hours, the options in case of stroke, we use few drugs called antiplatelet agents and anticoagulants, which are basically blood thinners, which can prevent progression of the clot in the brain. We also use statins, which are basically cholesterol lowering drugs, which also help in further progression of the stroke. The other drugs which have come into the picture recently are newer cerebroprotective agents, which are showing some promising results, and these drugs usually protect the brain from further damage in stroke.
On the eve of World Stroke Day, I would like to say few basic preventive measures about stroke. First thing is to check a regular blood pressure on regular monitoring. If you feel that the blood pressure is high, do make sure you'll consult your doctor on regular basis in lowering it. Second, stop smoking. Third is basically to take alcohol only in moderation. Fourth is to have a very good low salt and a low fat diet. Do keep exercise as your daily regime. Know your cholesterol levels on regular basis. In case you get to know the symptoms of stroke, try to come to the hospital as early as possible, which is basically a prevention better than cure.
Apollo has a team which consists of neurologist, neurosurgeon, emergency medicine and laboratory technicians, which can initiate treatment of stroke in no time. Some patients may require emergency clot buster. That will totally depend on how fast the patient has come to our hospital. And we also have an excellent rehabilitation unit to get the patient as close as possible to a functional lifestyle.